Hello viewer, we are here in a talk show and we shall be talking about choking. I know there are many times when somebody felt like you're being choked, something you cannot swallow, maybe because you are too embarrassed, you are in great anger. That is not the choking we are talking about. The real object, something being there on your throat, and you cannot be able to do what you are used to doing for free, which is breathing. We are here to discuss about choking. I have beautiful guests with me. I'm your host, Lucy Wanzakariuki. Welcome to the show. To my guests, welcome to the show. I'm sure we are going to learn. From the farthest end, kindly introduce yourself.
Hello dear viewers, my name is Irene Jambi. I'm a health and safety practitioner. I specialize in health and safety training such as first aid, and I'm also a health and safety auditor. Thank you for having us here today.
Thank you so much.
Hello everyone, my name is Anna. I'm a environment health and safety manager and the founder of Safety Plug, which is a YouTube channel where we talk about health, environment, and first aid matters. Thank you.
Thank you so much and welcome to the show. Irene, if I may come back to start with you. Choking, we have heard of it. Kindly talk to us.
Okay, so Lucy, when we talk about choking, we basically say it can be a temporary or permanent blockage of the airway that will result to difficulty in breathing. So it might be an object, it might be something in liquid form that might result to the choking, and in which later on might result to difficulty in breathing. Yes.
You've talked of permanent
or temporary.
or temporary.
Yes.
Which means it may be reversible or not.
Yeah.
What are some of the causes of choking, Anne?
Basically, one is just food. It might be,
Food.
yeah, when we are eating, like you have, as we say, have table manners. That's the way our mothers tell us to be slow when you're eating, so that we cannot have food move from the food pipe into the wind pipe where the air gets in. That is, yeah. So that is one cause of choking. Or your saliva, it can get there. Sometimes when someone is sick, vomiting, the vomit can get into the windpipe, which is very bad. Yeah, that one, yeah, it is very bad. So those are basically the causes of choking. Or sometimes for kids, when they're playing with their toys, they put them with their mouth, then they get to the wrong place. Yeah.
Okay, so which means choking is something that does not just come.
Just
it is
a trigger.
caused.
Yeah.
Yes. Are there signs and symptoms of choking?
Yes,
Yeah.
they are.
How will you know that someone is undergoing the choking thing?
Yes, I feel like each and every person who is alive right now has ever experienced choking. And the common sign and symptom that one has experienced is coughing. That is the first trigger mechanism. If I get choked, the first thing that my body will react to is me coughing, so that I can see if I can remove that object outside. You'll find someone might have teary eyes. They might have flaring nostrils, whereby you feel like you have mucus in your mouth. Other symptoms is difficulty in breathing. You might also observe congested blood vessels on the face and neck because your body is not getting enough oxygen as possible. That might be sudden collapse. If at all this condition exceeds a particular time and your body now lacks the oxygen that it requires for it to operate.
Okay.
And we have also something we call cyanosis. Cyanosis is whereby the color of your skin starts to change its color. It becomes grayish bluish because now if you are not intaking any oxygen, then circulation is also not okay. And lack of proper circulation in the body will result to the color change of your skin. That is a warning sign that a particular part of the body is not getting enough oxygen. Yeah.
You've talked of cyanosis.
Yeah.
I'm just thinking about it. Blue coloration of the skin. We have these people who are dark, like, let me not mention some tribes in our country.
Yes.
They are just dark. And now that is what you will have to observe. What will you see in them? Because if it's dark, blue, almost the same.
Okay, that is a very good question. So for someone who you cannot observe the change of color in the skin,
Yes.
you can look in two different areas. The first one is the inner part of the lip. So you'll have to observe the color change in the inner part of the lip or the nail tips. If at all that particular person does not have the nail polish. Yes. So that is how you will check for the cyanosis.
So in short, it's not just the coloration of the skin,
No.
as in where we can see.
Yes.
It can also be checked like what you've said under the tongue. Now, suppose you've just realized someone or your friend, your child is choking. What is the first thing you do?
The first thing you do is, before we get there, we have something we call the universal sign of choking, which is like this. Remember, when you're choking, there are people who have difficulty in talking. So they might not necessarily be able to come and tell you, help me, I am choking. So we always say that if you find someone is holding their neck like this, always assume that that particular person is choking.
It's a general assumption.
It's a general assumption that is used universally. Yes. So from there now, ask this person, are you choking? Remember, we said you have to seek consent. So if this particular person is choking, you'll advise them to continue coughing. Let them cough to try and see if that particular object that is stuck is going to come out. But you see, they might cough and cough and cough and cough until nothing is happening.
Yes.
So now it's time to take another step, which is you have to give them 5 back blows and 5 abdominal thrusts, which we are going to show during a demonstration.
Okay.
Yes.
So you said the universal thing is crossing your hands on your neck.
On your neck.
Yes.
Yeah.
Suppose you ask that someone, are you choking? And they show like no.
If then they show like no, then that means we are dealing with another whole new condition,
Okay.
which you are not aware of. Yeah.
Which you are not sure what
Which you
it
are not
is.
sure it is, yeah.
Okay. Suppose now is there a procedure, a universal procedure that you will use when someone is choking?
Yes, the universal procedure is normally 5 back blows or flows is to 5 Helmich maneuver, or what we called the abdominal thrusts. So back in our homes, the most common action that one does when you find someone is choking is knock them. So we are doing that, but at the back of our back, between the shoulder blades. Then you perform the 5 back blows. So there might be a blow or a flow, but you have to put intensity so that that pressure will be able to push the object out.
You know, when you talk of a blow, it must be very hard.
No.
Not very, very hard.
Because you said blows.
Yes, blows. 5 of
Somebody
them.
will be broken at the back.
Not really.
So what do you mean when you say a blow?
When you're saying, when you talk of a blow, we are basically trying to knock this person, but not with too much intensity to cause injury or damage. The same blow you will put when you're performing first aid management to an adult, it's not the same that you'll use to a baby or an infant.
Yes.
So you'll have also to gauge. It's not the same blow you'll put or administer to someone who is around maybe 80 years or so. So you'll have to check your casualty, their age, and then know at what intensity should you administer the blow.
You know, I'm still in the, you're still taking me back to the causes. Because I'm looking at it like, she talked mostly of food. or an object there. Does it mean that they are natural causes? You've not eaten food, the baby has not put something in the nose, but still they are choking. Like the way we are made, the genetic makeup, are there some natural causes of choking?
Okay, not necessarily. There are no natural causes of choking. You might remember this is the airway, blockage of the airway. The airway only accommodates air.
Yes.
It does not accommodate something that is liquid or something that is solid. Remember, you can get choked, but that particular object that you took went to the digestive system. And that is where now you can take water and everything will be okay. But in this particular point, it's a person whose airway has been blocked, either temporary or permanently. So no natural causes that are there that might result to choking, apart from maybe choking because of inhaling carbon monoxide or too much smoke or something that has fumes and fiber objects inside the air. Yes.
This is GBS TV Africa viewer. We are discussing about choking. We are going to continue after the break. Welcome back, viewer. It's choking that we are discussing about, and our guests are really taking us through this beautiful discussion. And choking is something that can affect everybody. We've all choked in one point in our lives, but now it can be permanent or temporary. That is what our guests have just introduced to us. Suppose someone is undergoing through a permanent choking. How will one know? Anne?
So, as you're trying to help this person, we say the first thing you do during first aid is call for help. You're not seeing any signs. So, the only person who will know that this is a permanent choke is the doctor, right?
Yes.
So the more I'm trying to help as a first aider, help is still coming. So you will be taken to the hospital. Then after the medical practitioners, the specialists have examined you, they will declare you that you are permanent, like permanent choke. You are permanently choked, and they are going to help you accordingly. Just the way we say, like a first aider can never declare someone is dead until the doctor says so. Unless whereby I find your head is over there and the other body is there, or your hemisphere, like this side and the other one, that one we can say, but I can never say you died. Yeah, or like, yeah.
So for a first aider, what you do is, if the object that had choked you has not come out, the next thing, if you've called the help and maybe the ambulance is not coming, you can do something to make sure that the patient arrives the hospital.
Yes.
Yeah, that is it.
While still choked.
Yeah, maybe to add a point on whatever Anne has said.
Yes.
Remember when we started, we described choking as a condition that will lead to difficulty in breathing. So my brain cells use oxygen for operation.
Yes.
If at all my brain cells lack enough oxygen, I'll get into a state of decreased consciousness, which might result to me becoming unconscious.
Yes.
So when you're speaking about permanent choking here, this is whereby you're giving this person first aid management, you're trying to remove this particular obstruction out, but it is not possible.
Yes.
And remember, more time is getting wasted, so the brain is lacking oxygen every second, and this person might resort to becoming unconscious. And because it is difficulty in breathing, chances are high they'll become unconscious, not breathing.
Yes.
So the primary survey now comes in. Check for danger, check for the response of the casualty, maintain an open airway in as much as they are breathing in, but not enough air is getting inside the lungs. Maintain an open airway, check for breathing to see if they are unconscious, not breathing, circulation, and you be ready to start CPR immediately.
Yes.
Remember, by this time you had called for help. So as you progress with the CPR, we're just hoping that you'll be lucky, the aiders will come beforehand. Yeah.
Okay, so for how long is one supposed to choke before all those tissues stop receiving the oxygen that they are needed?
So it depends now with how the object has been situated inside the body. If I give an example, if this is my airway and my object is a little bit slanted, then this person will have much more chances than someone whose object is has completely closed the airway. Because for this object that is slanted, it might give a small room for air to pass through, even if it is little by little. But for a person whose airway has been completely blocked, then we might lose that person very, very quickly.
Like in how many minutes?
When it comes to a state of someone who's unconscious, not breathing, the maximum time a brain can withstand completely without oxygen is 7 minutes. 7 minutes? Yes.
So we all these things that we are talking about should be done in 7 minutes?
They should be done in 7 or less.
Or less.
If at all you can be able, or less. Time is equals to tissues. Yes.
Time is equals to tissues. The more time you waste, the more tissues
get
we
damaged. Yeah.
The more tissues we lose.
Yes.
How now can you talk to us about management for choking?
Okay, when it comes to management for choking, we say that you have to be prompt. You have to be very quick. And there is a different way how we manage choking in an adult or an infant, a pregnant mother, or someone who has, you know, kula mali yake vizuri.
Yes.
And they have a big bump. And also a small child like an infant. An infant here now is a child who's 1 year and below. So we have different management methods, and also how to manage yourself in case you're choking and you're alone. How can you help yourself?
Yes.
Yeah. So we have different steps which we are going to look at as we do the demonstration.
Okay.
Yeah.
Before we do the demonstration, maybe you can take us through them so that when you're demonstrating, we just follow now.
Okay. So the first thing when you find someone is choking, just advise them to cough. Let them cough as much as possible. Once you identify that they are coughing and it's not working, now you step back behind the casualty's shoulder blades. Perform 5 back blows or flows. Then pass your hands underarm the casualties. Then between the sternum and the navel, the sternum is the bone that is normally crossing our chest, and the navel is the normal kitovu. So between the sternum and the navel, you create a fist, and your fist should be like this, because it is at this corner that you are going to use to perform the abdominal thrust, which you are going to push in and upwards, inwards and upwards 5 times. So you alternate 5 back blows, 5 abdominal thrusts. So once you do that, check if the casualty has removed the object. If not, redo again until the object comes out. So now you find at all, if the object does not come out and the casualty now becomes unconscious, not breathing, you start the CPR immediately. Yeah.
So the whole Dr. ABCD is a man.
It is a must.
Is a man that we cannot separate ourselves from, as long as we are doing any procedure that means we do something before we arrive in the hospital.
Yes.
You have to check all those.
Yeah.
Okay. You've said there are different situations which will determine the management. Suppose it's a baby, and you gave us the general signs and symptoms of choking. For a baby who will not be able to talk, you've talked of an infant. How will you like determine now it's time to go for management of choking?
So when it comes to infants, actually we are losing a lot of babies due to choking. And when an infant is choking, there are obvious signs that you're going to see. They might not be able to cry.
Yes, yes.
Or you can see them, they're trying to cry, but the sound is not coming out. You'll also identify them trying to gasp for air. It's like they're trying to swallow air because their body is not intaking as much air as possible. You'll also see signs of cyanosis, if at all it is a severe state of choking. And you might also see that the baby will have difficulty in movements. Remember we said that our brain, which manages our operation, requires the oxygen. And if the baby does not have enough oxygen, then it will result to other issues.
Yes.
And you know even that when our brain lacks enough oxygen, you might also start convulsing. So it depends with the state of the choking, if it is severe or minor. But those are the obvious signs that you're going to see.
For a baby.
For a baby.
Trying to cry, cannot cry.
Cannot cry. Trying to gasp for air.
Yes.
Some even, they pop their eyes.
Yeah. Yes, yes. And others even pass unnecessary stool.
Yes.
Yes. Yeah. Anna, we have those critically ill patients in the hospitals. And some of them do assisted feeding. How will you know that they've choked?
Do you mean like the one who cannot move the hands, or?
They are just very sick in the hospital.
Yeah.
May not be unconscious, but they are very sick. They need to be fed by their relatives.
So, you mean like you have visited me to the hospital, I'm sick, and I've started choking, how you are going to know?
Yes.
The same procedure. If I have energy, you'll just see me put the universal sign, and I'm coughing, you understand? If I'm light, you'll see if it is getting too much. You'll see the color change, you understand? Yeah, my eyes are popping, and then it will also depend with my age. If it is a baby, it is still the same procedure as she has said. It is not going to change because you are sick or healthy.
Yeah.
Yeah, the symptoms just persist. They are just the same, whether you are healthy or you are sick. You understand? Like a sick person, or whether you are male or female, you are just going to have the same symptoms. And the sign is just the same.
Are there methods or ways that we can prevent like choking? Because like Irene said, we all have choked at one particular point in time.
Yeah.
Yeah.
So like in safety, we say, in order to control safety, you do a risk assessment. That is where we look for the cause of the choking, right? For example, if it's a kid, they choked on their toy. So you don't want that to happen again to them or any other kid. Remove the toys where the kids are and put them above. You understand? If someone, the way you are saying, there's this particular person who is always choking, maybe they eat fast. You just talk with them. Try to eat slowly so that we can prevent this type of a scenario from happening again. You understand? So yeah, choking is just let me call an incident that happens. Nobody wants to choke. So when someone's choked for the second or third time, don't like insult them or refuse to help, thinking that they did it intentionally. No. Accidents happen unprepared. So just help.
Maybe just to add, we have to try as much as possible to avoid eating at the same time you're talking, at the same time you're trying to breathe in and out. We have an organ called the larynx, which people see as if it's another second tongue that we have. But its work is when you're swallowing food, it closes the airway and food passes through the digestive system. When you're breathing in, it closes the digestive system and air passes through the airway system. It is like men. It cannot serve two masters at a time. So when you're talking, you're swallowing, you're still breathing in, inachanganikiwa, it gets confused. That is where you find a piece of rice has through the nose.
This is DBS TV Africa. We are going to continue after a break. Welcome viewer, we are now demonstrating a few things here when a baby or a person has been choked. We didn't come with babies, but we have some who are not natural, but I'm sure we are going to learn something. Before we do that, there are some myths and misconceptions. What does your community or the surrounding that you live believe in when one has been choked? Maybe we are going to hear just a few of them from Anne.
Hi everyone. So some of the things that we do wrong because of beliefs is eating an extra piece of portion. For example, in Kenya, most people say that if a fish bone has blocked your airway or you are choking from it, you eat hot ugali, it is going to help. That is a lie. You could even obstruct the airway more if it has gone to the trachea. So kindly don't repeat that and spread the message. Follow the right first aid procedures we have explained, and everyone is going to be safe. Another thing I would like to add about choking, it's more of a cause when mothers and ourselves, they are feeding babies, they are not patient enough with them. They feel that every parent or any caretaker of a baby or someone who is young, just be patient. You don't have to force them to eat a meal that they don't like. Even if it is medicine, find a right way to give the child the meal. For example, let me just demonstrate using our dummy over here. I know most of you have seen it. A baby is usually pinched on the nose and then they start giving the meal. So have you ever tried doing that to yourself when you are eating? And then even the position, like you are being manhandled like this, and then you are being pinched and you have been given porridge. You will actually cause the choking of the baby. So let me ask you a question. You are a parent, you are out working, and you are yourself, they have seen you do that. Maybe there's a proper way. I'm sure some of you are saying, I've had children, they are not hard out, and I used to do that to them. So what if someone does that wrongly and they kill your baby, then later they say the baby choked, you weren't there, what are you going to see? Or you have CCTVs in your house and then you see you're going to sue someone's daughter or son and say they killed your kid, yet they learned that from you. So kindly let us be patient with our children and not pinch them or force them to have a meal. Maybe they just don't like it, or we have been overfeeding them with that meal. Yeah, understand?
Thank you so much,
you're
Anna.
welcome.
Yeah, so we understand that it is going to confuse that organ which you said closes and opens the airway. Kindly demonstrate to us. This baby has choked, or you suspect choking. How are you going to do it?
Okay.
And you will also tell us if that is what we should do at home.
Okay, so if at all you have experienced or you experience someone, an infant who is choking, and you've seen that they've tried to cough, the particular object is not coming out, the next step you'll do is you will look for a place where you can sit and comfortably support yourself and the baby. From there, turn the baby, making sure that the level of the head is below the level of the legs, and your hand should be in between the baby's legs. Remember, you have to support the head and the neck very well, because you know the delicate part of a baby is the head and the neck, especially an infant.
Yes.
So when you're supporting the head, make sure that you try as much as possible not to completely block the mouth and the nose, because they are still trying also to continue breathing. So from there now, between the shoulder blades, we have a bone and a bone. Between those blades, you perform the 5 back blows or flows. So it's 1, 2, 3, 4, 5. Turn the baby. Still the same position. The head is lower than the level of the legs, and your hand is in between the baby's legs. Then on the nipples of the baby, we are going to draw a straight line where your fingers meet. Now, in an infant, we don't perform abdominal thrusts. We perform chest thrusts. Using 2 fingers, you push inwards and upwards 5 times. So it's 1, 2, 3, 4, 5. Check if the object is out. If it is not, turn the baby again, still at the same position, 5 back blows or flows. 1, 2, 3, 4, 5. Turn the baby, 5 chest thrusts. Check if the object is out. If it is not, you alternate. You might find that you can see the object, but it's a little bit deeper. We normally recommend that you should not perform a mouth swab. Reason being, I might be quick to perform the mouth swab, and then I end up pushing the object further
Back.
inside.
Yes.
So the only time you can remove an object is if you can see it's on the teeth now. It's almost there. And before you do that, we can recommend that you can turn the baby sideways to see if that particular object will flow out before you decide to do the mouth swab.
Okay.
Yeah. So remember, it is 5 back blows, 5 chest thrusts. 5 back blows, 5 chest thrusts. Check if the object is out. If it is not, you alternate.
How many cycles?
So in choking, I normally recommend that you can do as many cycles as you can. But the most important thing is you have to be ready to perform CPR in case the baby becomes unconscious and not breathing. And when you are performing CPR on a baby, it is still the same ratio, 30 chest compressions is to 2 breaths. Make sure you perform the CPR on a hard surface. But now the difference between an adult and a baby is we will not use the whole of our hand to perform the CPR.
Yes.
Where the nipples are, you draw a straight line where your fingers meet. You use 2 fingers to give the 30 chest compressions.
Yes.
So it might be this way or this way, depending on the comfortability that
And also
you feel.
the size of the baby.
Yes, the comfortability that you feel, you can be able to effectively and efficiently give the 30 chest compressions.
Yes.
And then after the 30 chest compressions, now you give the 2 breaths. And in a baby, we normally recommend, if the baby is yours, as you're giving the 2 breaths, you can try to make sure your mouth covers both the nose and the mouth. Because you want the baby to accommodate as much air as possible. Yeah.
Is the mouth-to-mouth breathing still in order today? In the era of COVID-19, in the era of HIV, despite the fact that you still showed us that gadget which can be used for breathing.
Okay, yes, it is still in order, but remember we said, if at all there are any circumstances that will prevent you from giving the mouth to mouth, then do not. It is not a must. For example, in the era of COVID, like right now during the era of COVID, it was not advisable for you to give a mouth-to-mouth assessment because you might end up transferring the condition to another person.
In fact, it was even impossible because of the PPE, the high-level PPE used at that time.
Yes. So what you do is you just perform the chest thrust, and that's
You may also have oxygen flowing, and you have the ampu bags.
Yeah.
Do you really need mouth to mouth with a ampu bag?
No. If you have,
In fact, this is because it was first aid, and all those things maybe are inaccessible.
Yes.
But in case such occurs in an hospital setup, because we said someone can choke anytime,
Yeah.
anywhere. So it can also be within the hospital. We do not need all that. We need the oxygen
Yes.
and the ampu bags.
Yeah.
Thank you so much, Irene, for that. I don't know if you would like to demonstrate if an adult, because I'm sure this was lenient.
Yes.
We've seen in the myths and misconceptions, you have to give 5 blows at the back like you're fighting. Yes, kindly welcome so that she will use you to demonstrate.
But she's coughing, the object is still there.
Yes.
So the next step I'll do is I will come behind the casualty. And when I'm behind the casualty, I will put one of my leg in between the casualty's legs.
Yes.
Reason being, because they have difficulty in breathing, they might become unconscious at any time.
Yes.
So in this position, even if there is that sudden fall, I will be able to support my casualty
yes.
compared to when I'm standing like this.
That, yes. You might all fall down.
Yes, you might all fall down.
Yes.
So make sure one leg is in between the casualty's leg for support. Then one hand will support the front part of the casualty. Advise the casualty to lean forward because we want the object to
fall down.
To protrude in this direction.
Yes, yes, yes.
Then between the shoulder blades. So the shoulder blades are here. We have a shoulder blade here and another one here. So here in between is where we are going to perform the 5 back blows or flows. So I will count 1, 2, 3, 4, 5.
Oh, wow.
Remember, you have to use to be intensify your blows depending on the casualty. So I've performed the 5 back blows.
Yes.
Now it's time to perform the abdominal thrust, which we said it's in between the sternum and the navel. So we said you create a fist, and your fist should look like this. So when I'm placing my fist, you will note I'm not placing it like this. It's like this.
Yes, yes.
Where the corner is, that is where I'm going to place my fist. Then advise the casualty to lean forward. Then using my other hand, I'm going to support my fist. So I'm going to push inwards and upwards. So 5 times. So it's 1, 2, 3, 4, 5.
Yes.
Check if the object is out. If the object is not out, you do again.
You repeat the
you
cycles.
alternate. 5 back blows, 5 abdominal thrusts.
Yes.
And you might see that my casualty might be too tall.
Yes.
Or I might be
Like
also
in
too
this
tall,
circumstance.
like in this circumstance.
Yes.
We said you have to use common sense. Try and look for anything that you'll be able to accommodate you for you to perform the management effectively.
Yes.
For example, if she's too tall, I can request her to sit on the chair so that I can be able to reach her when I'm doing the 5 abdominal thrusts.
Thank you so much to our guest.
We'll still do the same process. Advise the casualty to cough. If they cough and the object is not coming out,
yes,
stand at the back of the casualty. Remember, one leg should be in between the casualty's legs. Support. Advise the casualty to lean forward. Give the 5 back blows. 1, 2, 3, 4, 5. So the next step I'm going to do is to give the abdominal thrust. But you see, because of the pregnancy,
yes,
it might be impossible for me to round my hands around the casualty. So what we do is one hand passes over the shoulder and the other hand underneath the armpit for them to meet.
Yes.
And in this particular point, you can see I can't be able to reach my casualty. So I will advise my casualty to sit down, one hand above the shoulders, the other one below the armpits. Make a fist, place in, advise the casualty to lean forward and perform your 5 abdominal thrusts. So it's 1, 2, 3, 4, 5. Check if the object is out. If it is not out, repeat. 5 back blows, 5 abdominal thrust. Remember, for this one hand is crossing over the shoulders.
Yes.
Yeah.
What is the outcome for choking?
So the
They
outcome,
call it prognosis.
yes, the prognosis for choking might be 2. The casualty might survive the scenario, and the casualty might not survive the scenario.
Yes.
This will depend with a few factors like, number 1, what is the cause of the choking in the first place?
Yes.
It might be some poisonous fumes, and that will be hard to manage.
Yeah.
It might be just a temporary choking or obstruction of the airway, but it might also be a permanent one.
Yeah, yeah.
So the end results are different. Another factor is how quick did we manage the situation? Did we find the casualty already unconscious? Did we come in too late?
Yes.
So it depends with a lot of factors. Yeah. I feel like some of the things that the government should put in place when it comes to choking, especially for our newborn mothers, they should be having a small session in the hospital, like just like the way we have a small family session in the hospital,
Yes.
for them to be advised in case maybe you're breastfeeding your child and they get choked. What is the right thing to do? Is it only just, what they do is they blow some air on the forehead? How will that remove obstruction?
It's a myth.
It's a myth and misconception. So if I tell this casualty, this particular
Or a
casualty,
paper on the
or a
face.
paper, if they have permanent choking, then I will only blow air on the forehead for a small time and lose my baby forever. So also how you're supposed to lay your baby down. You're not supposed to lay your baby down when their head is facing upwards, because if at all they remove the milk residue, which they do a lot, then chances are high it will go back in and cause choking. So things like this should be incorporated in our government hospitals. And also, we might have a forum for educating our mothers on how to properly handle these casualties. Yeah.
Thank you so much, Irene. Maybe we start with Anne to give us your parting shot and remind us where we can get you.
So before I go there, I'd like to add on our government. I do feel that if our students at school, there was a compulsory first aid session, we would save a lot of lives, because sometimes kids are just out there playing, then they get choked, right? And then some TV commercials on first aid. My parting shot is always be the change you wish for, and remember to kindly subscribe to our channel, Safety Plug, and keep sending us your requests there, and we're going to learn together and grow together. Thank you.
Mine is very simple. My slogan, remember, your safety comes first and safety begins with you. Until next time.
Thank you so much to our guests. It was a pleasure having you in this show. This is TBS TV Africa. We were discussing about choking, and in the following series, we are going to bring you several events which will warrant you to use first aid. I was your host, Lucy Wansakariuki. Bye-bye.